If you're overweight and have been struggling to shed the pounds, the last thing you may want to do is have weight loss surgery. Fortunately, Lake Area Medical Center offers non-surgical weight loss solutions and a program for a healthier lifestyle. Dr. SELIM is here to tell us what Orbera is, because this is something that is done for a short period of time, 6 months.
Correct, Amy. So it's a balloon that's filled with fluid that we put non-surgically through an endoscopy through the mouth into the stomach. And as you see, if this mannequin is the stomach, not your stomach, my stomach.
This is not an approximate size. Right?
Yes, exactly. And this is the esophagus, and that goes to the small bowel. This is a balloon here. That's what you see. And we put it through the scope, through the esophagus, into the stomach, and we start blowing it up with some fluid. This rests in the stomach for 6 months, and then we come back and take it out after 6 months. It's just recently approved in the United States of America. The FDA approved this in 2015, actually, but the results, most of the results and the studies came from Europe and from the other part of the world, where it goes back to 15 years. So we have some good solid data. Goes back to 15 years experience, but not in the States, unfortunately. But we are going to build it.
Once someone has this put in place, over 6 months, how much weight can they expect to lose?
The report stated about 30% of the excess body weight.
Wow, that's pretty extensive.
It is. It is.
That's a substantial amount. And then after 6 months, when it's removed, how much of a chance is there that they're going to balloon right back and put the weight back on?
That's a very good question. The studies again shows that these patients can maintain, it's about 67% of them can maintain their weight loss for 2 years to 5 years.
Wow.
So that's a good percentage, because it's not only the balloon functions in a different way. So first of all, when you put it in, it actually makes you feel full faster, but over the 6 months it develops what's called slow gastric emptying. So the stomach will start being lazy, if we can say. Okay. So the food sits longer. So that's how you maintain weight loss for a longer time.
All right, so actually it's not something that just the balloon is inserted, it's filled with fluids, and something happens right then. This is actually a prolonged...
It's a process.
It is a prolonged process. It's
Correct.
so interesting. Does someone have to be completely knocked out to be able to have it put in place?
It is actually, it's like a scope. It's like you do a scope upper or lower or colonoscopy. Yes, it's not like general anesthesia, but we give the patient some drugs to make them sleepy so they don't remember anything.
All right, no pain, no surgery. You don't have any of that recovery from having a major surgery done, and you get all that benefits, 30% weight loss in some cases. That's
Correct.
Incredible. Thanks so much, doctor, for
My
coming
pleasure.
by to tell
Call
us
us
about
502-8706, and we will be more than happy to help with that.
All right, get yourself a consultation and get the weight off today. Thanks again.
Thank you.
We'll stay